The number of deaths in connection with the coronavirus outbreak has now risen to nearly 640, and the number of people infected worldwide has climbed to more than 31,000. Here in the U.S., though, the number is still holding steady, with the CDC confirming those 12 cases. Meantime, another flight of evacuees from Wuhan, China, the center of this outbreak, arrived overnight at Travis Air Force Base there in Fairfield. This brings the number of people quarantined there at that base to 234. Joining me now to talk more about the coronavirus is KTVU medical expert Dr. Larry Burchett. Dr. Larry, thank you so much for being here. There is concern and a lot of questions about this. First of all, tell people what the coronavirus is and how it's different from the flu.
You know, you can get a cold, that's one kind of virus, and then you can get the flu, that's influenza, right? It's a different virus. Coronavirus similarly causes a respiratory illness, but it's a different bird. Number one, usually comes from animals, can be people to people transmitted, but then it's associated with these big historical scary things like SARS and MERS, where the mortality rate of that thing, don't freak out, I don't want people to freak out because we're safe here, but was up to 10%.
Right.
So if hundreds of millions of people get sick, that is a huge bad thing. And that's why we're mobilizing all of this public health. Influenza, what's the mortality rate with that? Under 0.1%. Millions of people get it. 20 million people have had it this flu season alone. We have like 10,000 deaths in the US from that. No deaths from corona, 12 cases. They're not comparable, but this corona, it's scary because it has that potential, but I don't think it's as contagious.
So how concerned should people be?
Have you gone to China?
No.
You and I were talking,
right.
And you were a little bit concerned of going into San Francisco, you know, should I be afraid? I don't think so. I think you should be more afraid of the flu, you know? So, like I was saying, with influenza is so much more out there and potential to get us sick. So the CDC's come out and they said, look, if somebody's worried about it, they come in. This is the questions that you ask them. Number one, have they been to China, specifically that Wuhan city and province? And two, have they been in contact with anybody who has had that virus? So one of the cases in the Bay Area in Santa Clara was a guy who got it in China, came back and he gave it to his wife. They're both quarantined away from the public. They're not going to transmit it, right?
Right. So given that we have seen just those 12 cases here in the U.S., what does that tell you about things? And we also know that there are several laboratories, including the one in Richmond, working to try to get ahead of this. How close do you think we are and to really making sure that this is not going to spread further?
Gosh, I feel pretty good about it.
Yeah.
I mean, you know, China has limited travel. The U.S. has kind of put one of these big travel bans on. The people that do come back, that do have some risk, we're putting them in military quarantines. It's kind of crazy. I mean, it's a robust public health response. It's a great exercise, but 12 cases in the whole
What do you,
country.
though, make of, you know, on this cruise ship, we are seeing the number of cases on this cruise ship in which people are quarantined basically to the rooms, but more people are getting it.
Well, it's the same principle, right? Is it China? Are there Chinese people on it? People coming from that area that now have it? Great. Let's use those same principles to limit and stop the transmission. I don't want that port rolling into San Francisco, and they won't let it.
Yeah. All right. Well, thanks so much for providing some perspective on this. A lot of people have a lot of questions about it, and you've answered many of them. Thank you so much, Dr. Larry. Appreciate it.